How do doctors diagnose accelerated phase CML? Imagine trying to catch a disease before it gets worse. That's exactly what doctors do when diagnosing accelerated phase chronic myeloid leukemia. This phase signals that the disease is progressing from its initial, more manageable stage. To figure out if someone is in this more advanced phase, doctors combine several steps involving clinical evaluation, lab tests, and specific criteria. First, they look for signs that the leukemia cells are increasing rapidly. One key sign is the presence of more myeloblasts, which are immature leukemia cells. If these make up between 10 and 30% of the cells in the blood or bone marrow, that's a red flag. Doctors also check the white blood cell count. If it's over 50,000 cells per microliter, that suggests the disease is advancing. Platelet counts are examined too. Either a significant increase or decrease can point to progression. Anemia or low red blood cell levels despite treatment can also be a clue. Another important sign is splenomegaly, which means the spleen is enlarging. Sometimes, leukemia cells spread outside the bone marrow and spleen, forming tumor nodules in other parts of the body. The presence of additional chromosomal abnormalities beyond the Philadelphia chromosome, which is characteristic of CML, can also indicate progression. Persistent symptoms like unexplained fever or bone pain are considered as well. To confirm these signs, doctors perform specific tests. A complete blood count with differential helps identify abnormalities in blood cell counts. Bone marrow aspiration and biopsy are crucial because they show the cellular makeup of the marrow and reveal any chromosomal changes. Cytogenetic analysis, including karyotyping and fluorescence in situ hybridization, detects the Philadelphia chromosome and other chromosomal abnormalities. Molecular testing, especially reverse transcription polymerase chain reaction, is used to identify the BCR-ABL1 fusion gene, which is a hallmark of CML. Doctors also conduct a thorough physical exam and review the patient's medical history. Symptoms like fever, fatigue, and an enlarged spleen help gauge how far the disease has progressed. Once diagnosed with accelerated phase CML, treatment becomes more aggressive. Tyrosine kinase inhibitors are usually the first choice, with options like imatinib, nilotinib, or dasatinib. In some cases, doctors might consider more intensive therapies, including chemotherapy or other targeted treatments. Understanding how doctors diagnose this phase helps in appreciating the importance of early detection and proper management. If you or someone you know is dealing with CML, it's essential to work closely with healthcare professionals who can interpret these tests accurately. Always remember that each case is unique, and personalized medical advice is key to effective treatment.